All right, folks, thanks for tuning in. We're going to show you how we do Graston technique on a QL muscle and on the glute. Her hip is bothering her. She said that you had some muscle spasms there on that right side. So we're going to show you how we're going to demonstrate that. So go ahead and lay on your side facing that way. And she was able to loosen it up a little bit with some yoga. I want to note that she is a yoga instructor. So you'll have to give us your information for teaching yoga. You teach online, right?
In person.
In person
Yeah.
and online, okay. So we're going to use the wider curve here. There's many different tools that you can use that are myofascial tools, or IASTM is what it's also called. And a lot of different ones out there. Graston makes their own. These are rock blades. They started out making tape, kinesio tape. I'm going to show you how we do the right side here. I'm just going to lift your shirt up here. And I'm sorry here, we're going to have to show the top here of your glute. Okay. Yep. Okay. And then bend this leg here for me, just like that. Good. So I'm just going to put some lubricant here on the, some lotion here to make it glide better on her glute. We're also going to be getting a little bit of the multifidus. And this area can turn a little bit red. This is the first time we're doing this technique on her. We've done a lot of different myofascial release, ART mostly with you, right?
Yeah.
So you should respond really well to this. Okay. And you're going to feel that, like a little bit of crunchiness there in the soft tissue.
Mm-hmm.
Okay. And right now I'm starting with the duller blade for her the first time and see how she responds to this, and then we can go with something a little bit sharper. And sometimes people do, they have like a tight area and they get in there with like a lacrosse ball or foam roller, and then for some people they say that it makes them worse, and that's usually because there's some soft tissue damage in there and you're just overdoing it. You're inflaming the area and overdoing it, and that's why it gets worse for a few days after. It's like getting a deep tissue massage in one area. Sometimes people do it for 10, 20, 30 minutes. That's going to make anybody sore, including me. How are we doing there? So she had asked me before if we would do this before or after an adjustment. I typically like to do this before an adjustment. It makes the adjustment easier, but it can be done after an adjustment as well. So we want to do different strokes here and different patterns right in there. Yeah. We're getting into the top of the IT band too. A little bit of the multifidus.
So the pinch that I'm feeling too is also, it's like above my hip bone.
Okay, more in the QL. Okay. So just above where I am right now.
Mm-hmm. Yeah, kind of on the back side, like closer to my spine or something.
Okay.
It's like deep inside, so it's probably around where you want to.
Now we're going to go in there and do her quadratus lumborum muscles, which are closer to the spine. And I'm going to use a little bit of a different angle for that one to get in there. I'd like you to bend your knee if you could, yeah, and if you could do that one too. You can bend them both. Might balance you better. There you go.
Yeah, right there.
Right in there,
Yeah, oh, that's it.
You could see, or maybe you can't. Her skin's a little red here, but it's not as bad. We did it on somebody earlier today on his shoulder, and his shoulder got really red. So if you're fair skinned, you're going to get a little red. It's not a big deal. Some blanching on the skin, no problem. No worries at all. But if it's your first time doing this, and you can buy these and get these for yourself and use them on yourself. Hard to reach some of these areas, like this area, but you okay?
Oh yeah, it's really good.
Okay. Right there, you feel that? Okay. I'm gonna wipe the lotion off here. Okay, you're all set there. Go ahead and lay on your stomach. Now, we've done another video on her. She has degenerative disc at L5S1, and she doesn't do too well being put on her side, which is what most chiropractors would do when adjusting her lower back. So we just don't do that. We know better. Right?
Yeah, I was seeing other chiropractors before you that adjusted me on my side a lot, and I truly believe it made me worse. And as soon as I saw you, I think it took 2 visits. You were like, "Yep, we're never gonna do you on the side."
Yeah, we adjusted her on the side once, and she didn't respond well at all to that. And anyway, for a degenerative disc, and I remember telling her before doing that adjustment that it's not the typical, it's not the best adjustment for a degenerative disc. The best adjustment is flexion distraction technique and a gentler technique like Thompson. So we're going to do a little Thompson technique here on her lower back. I'm going to have you slide up a little bit for me. Okay. Yep. So her hip on the right side, the one that we just did Grafton on, is higher, pulled up and forward. So we're going to correct that. We're going to contact the opposite hip, and then the hip that was pulled forward and higher, we're going to contact down lower here near her lower buttock region. And this is a light force technique that works much better, much gentler rather than a twisting motion. And then I follow it up here with some flexion distraction technique. And that works really well for her, for anybody with a degenerative disc.
Yeah, the pain I feel in my lower back now has gone down so much.
It has already, okay.
I almost don't even remember that I used to be in pain there.
Good. Looks like you're breaking in some new sandals there. You got your...
Oh my gosh, yeah.
Your
The
heel...
backs of my legs are not catching a break, man.
No. Okay. All right, so now we're going to go into some gentle flexion distraction. Just to open up that space at L5S1. You can have a degenerative disc anywhere. It doesn't have to be L5S1, but L5S1 is the most common place for a disc to degenerate in the lower back. And then after one disc degenerates, that puts pressure on the other discs above and below, if there are any discs below it. So real important to take care of any degenerative discs you have, whether you're symptomatic or not. And Jade here, you're not really symptomatic anymore, right? She's on maintenance care now, so she's not symptomatic like she was when she first came in. And how does that feel?
Feels great.
Yeah. And unfortunately, life compresses our spines. You know, it's inevitable. Sitting and just everything that we do. So that's where maintenance care can come in and does come in. And I can't adjust myself. I'm a chiropractor. I get adjusted maybe once a month, give or take, depending on what I'm going through. Okay, that's much better. Your legs are balanced now. Let's just double check the pelvis. Good. Okay, now I'm going to have you take a deep breath in, bend both knees. Yep. And deep breath in. And blow all the way out. And drop your legs down. And on your back. Okay, let's see your hands up in the air. Good, relax there. Let me know if you bruise at all in that right hip area. You shouldn't, but let me know if you do, okay?
Yeah.
So if you're a layperson, you're considering buying one of these IASTM devices, and you're a layperson, I would recommend taking a course in it or watching some videos on how to use it, so you know what you're doing. You don't need to be a professional to do it effectively. Relax here. But you do need to know what you're doing and how much pressure you should be using so you don't aggravate the condition. And also, if you're using one of these devices and the pain continues, 2 weeks later, go seek a professional right away. Relax your head here. We're going to do some stair stepping. So, as I've told you before, what this does is it helps get the facet joints in the neck gliding better. Small figure eights here.
I can feel such a difference from the first time you ever did that to me to now.
Mm-hmm.
Like I glide so much better.
Yeah, I love that move. It's
my
a
favorite.
maneuver I've never had any chiropractor do
Yeah, me
to me.
neither.
The only time I've ever had it done to me was in college, in chiropractic school. There was a chiropractor from Egypt. Ironically, his name was Dr. Saddam Hussein. He was the nicest guy ever. One of my favorite teachers, and he taught me this. And it's not something that's regularly taught. I've never seen a chiropractor do it. I just think it's a really great little adjunct to the adjustment. Okay, you're all set.
Thank you so much.
Thanks for letting everybody see how we use Graston
It was
tools.
awesome. It felt really great.
Great. Thanks for tuning in, everyone. See you soon.